The disease called polio is one of our most ancient scourges. Tragically, most victims are children, and it has been crippling them and destroying their futures for centuries. In the last 20 years, however, the number of polio cases worldwide has dropped by 99%. Not long ago, the World Health Organization declared India polio-free. Other developing nations are reporting progress that would have seemed a fantasy in 1955, when Dr. Jonas Salk's vaccine was first declared safe and effective. What made it happen? Money. Lots of it. From national governments, international agencies, and the Bill and Melinda Gates Foundation. The foundation also brought to the fight its expertise in using data to understand problems and help solve them. Using that data, national governments planned carefully. They funded huge public education campaigns. Most important, they recruited millions of workers and volunteers to bring polio vaccine to homes, health clinics and schools, village squares and bus stops, markets, temples, and mosques. The goal was simple: to vaccinate every man, woman, and child in the nation. What made that ambitious goal possible? Satellite technology. Without the help of the invisible infrastructure overhead, the battle against polio could never have been won. First, it was the turn of eyes in the sky. Poor nations like India, Nigeria, and Afghanistan, where polio was widespread, are also poorly mapped. In mountains, jungles, and plains lie villages known to no one but the people who live there. But satellites can find them. A company called ESRI is the world's leading provider of geographic data based on satellite, and it provided the governments of these nations with incredibly detailed digital maps. Using these maps, planners created vaccination campaigns that could go where literally everyone lived. Then it was the turn of global positioning via satellite. The campaigns put hundreds of thousands of GPS-equipped mobile phones into the hands of vaccinators. Software in the phones recorded their exact location throughout the day. At day's end, the vaccinators returned the phones to be recharged. While they slept, the tracking data was uploaded from the phones to the mapping system. This let campaign managers see where each vaccinator had been the day before. It revealed gaps where no one had made a visit, so that vaccine could be delivered there the next day. It allowed nations to blanket their households, from the luxurious homes of the rich to the barest hut of the poor, with life-saving medicine. We can never know just how much human suffering the defeat of polio will prevent, but we can put numbers to the savings on medical care and the addition of healthy, productive adults to the workforce. Experts estimate that additional value at $40 to $50 billion, most of it going to poor nations. The war against disease is never completely won, but the battle against polio? That is one fight that people in the satellite business are proud to call their own.
Brought to you by the Society of Satellite Professionals International, with the support of PHASOR.